Spiderman package, and there's another package. If you don't have, just come and grab it, and make sure we sign in. And I left it on page number 10. We finished about burn, a little bit information, and I will be starting. Are we okay to hear my voice? Is okay? All right. So on page 11, we will go back on page 11. And page 11 on Spiderman package is number 90, is birth weight. That goes in your PEDS question in double by 6 months and triple by 1 year. Number 91 is heart rate. When you must check when you're giving digoxin. And so it says, do not give digoxin to children if the heart rate is below 100. Are we clear? So you are checking the heart rate. For adult is below 60, but children heart rate, you got to know your newborn babies, 6-month-old baby, their heart rate is much higher than 100. So if it is 100, you can give it to them. Number 92 is, again, is your PEDS question, is cystic fibrosis. And I will write it down, and I want those who have not done PEDS with me, but you must remember, is in cystic fibrosis, is multiple problem with the babies. So I will write it down here. In cystic fibrosis, is important wording is, it's a exocrine gland disorders. Exocrine gland disorder. Endocrine is the fluid in the body going directly. Exocrine means other glands, and the body fluid become thick. That's why exocrine gland. And write down the word, the fluids are very thick, like pancreas. And exocrine gland, and it's a multi-system disorder. Multi-system, that means not one area, there are few areas are affected. Number 1 is lungs are affected because they have a thick phlegm. And what does it cause them in the lungs? Remember one word, hypoxia. They have lack of oxygen. Toys should be more sit-down toys. Why? Because even their age, and they can go on bike, but what will happen? They can breathe. Are we clear? So breathing problem, keep that in mind. Any toy selection, read your question. Child has cystic fibrosis. What toys are you going to give? Something they can sit and play, you're going to give them. And number 2, remember, because they can get infection, so prevent them from infection. Question can be CPT, bronchodilator, increased fluids. Any of these goes in your lung question. So number 1, lungs are affected. Number 2, in GI, what happened in GI? Low pancreatic enzyme. And whenever you have low pancreatic enzyme, digestion of fat. So what diet do you cut down here? Low fat. Very important, the fat you will cut down. And you can increase carb, you can increase protein is okay, but very important, you cut down fat, okay? And you give them pancreatic enzyme. And yesterday, I said also Viocase. Viocase is a enzyme, and give them with meals and snacks. So they ask you, when do you give Viocase, or when do you give pancreatic enzyme? You give them with the food when child is eating, because it will help them in digestion of fat. So everyone, remember the wording. Lungs is important, GI is important. You are cutting down what in the diet? Fat, and we are giving pancreatic enzyme. Number 3 is, and whenever you are giving and you are cutting down fat, they are not absorbing fat-soluble vitamin. What are your fat-soluble vitamins? Are vitamin A, D, E, K. So you got to put together here. Number 3, mother says baby is very salty. So they're losing salty integumentary system in the skin. Mother says when I kiss my baby, they're very salty. They're losing a lot of salt in their sweat and tears. So in your diet question, you will be increasing here salt. So remember, two things. You increase salt and you decrease fat. Number 4, when they grow up, they may not be able to produce the children and can lead to sterility. The reason the sperms may not be able to pass through. Page number 11. So you have to monitor for sterility, okay? So you got to go ahead and write it down. If you know, that's good. But it's all up to you how you're going to memorize. But you got to put all information together. 4 problem in the babies with cystic fibrosis. Page number 11, and I was on number 92. Not passing meconium. And sometimes when the babies are born, they may have underlined the word meconium ileus because of the fat and the digestion, and they may not be able to pass the meconium. But these all answers I want you to write down. Number 93, heart defect. And it says cyanotic, underline the word cyanotic. And in the box you have tetralogy of Fallot. And also is arteriosis and great vessels problem. That means is the babies are blue babies. And tetralogy of Fallot, we said. They need to be corrected. If they don't correct them, in the last line, highlight the word child would go in heart failure, CHF. And I want you to write down what is cyanotic babies are clubbing of finger. Clubbing of finger because lack of oxygen. Failure to thrive. And they will be giving them medication, digoxin, and feed them slowly because they get tired easily. So in 93 goes in your PED question again for your cyanotic babies or tetralogy of Fallot. We already talked about that in the previous pages. But must remember clubbing of finger, digoxin side effect is vomiting and bradycardia. Number 94, when they're doing cardiac catheterization, right side, highlight that word, they're checking valves. They're checking in the heart. We have tricuspid valve and bicuspid valve. When they're doing left side, they're checking coronary artery complication. So cardiac cath question. I want you to remind you, what do you do when patient come back after cardiac catheterization? What do you do on cardiac catheterization? Number 1, bed rest. So write down on the side, bed rest. What do we monitor patient after cardiac cath? Bleeding. 3rd thing, hematoma. And 4th one, peripheral pulses. So everyone, what do we monitor? Bed rest. Monitor for bleeding, hematoma, peripheral pulses, and apply pressure to prevent bleeding. Are we clear? Very important. This 4 wording we all need to know. Patient is going for cardiac catheterization. They're looking at abnormalities in the heart. Next is very important is again in your PEDS question, rheumatic fever. When we have child rheumatic fever, it says cardiac valve. Highlight the word, valves are affected. But I want you to add few things here. And I want to definitely you guys memorize good. Rheumatic fever comes from sore throats. And write down on the side, and streptococcal infection. So sore throat and streptococcal, strep infection. And what is the child is having a problem? Now here it says heart. And I want you, where it says the valves are, or cardiac valves are malfunctioning, number 1, in cardiac, you must know what valves is affected. Mitral valve, write down that. Where is your mitral valve is in the left side of the heart. Left side of the heart, that means between left atrium and left ventricle. So we must know where is the mitral valve is on the left side of the heart. And where is it? Between left atrium and left ventricle. Number 2 problem is the brain. What happened in the brain is they're shaking. And they use the word is syndham chorea, S-Y-N-D-H-A-M, syndham chorea. That means shaking. And they may throw the word Spiderman chorea. Everyone should know the rheumatic fever is affecting the heart, affecting the brain, and number 3 is they have joints. And in the joints all joints are very painful and inflammation. On the skin, they have nodules and they call erythema marginatum. Erythema marginatum, or remember the word on the skin is involved. So there are 4 problems in the babies are here. Rheumatic fever. When you remember rheumatic fever, you never know what answers they're going to give you, what question they're going to give you. But if you keep your information together, we all know what is rheumatic fever is affecting is the brain and affecting the skin, syndham chorea, shakiness. When you see the word as chorea, that is affecting the brain. Joints are affected. Skin are affected. Erythema marginatum, T-U-M, or that means they have rashes and the nodules on the skin. How do you diagnose? Another question is everyone should write down the word ASO and ESR. ESR is erythrocyte segmentation rate. Erythrocyte segmentation rate. ASO is anti-streptolysin titer, or titer. So these are blood tests, very important in the babies, they have to do it. And how do you treat them? It's infection, they're giving medication. But remember, because the heart is involved, your first answer, bed rest. And for answer, give rest in between activities. Why? Because the heart is involved. And what is mitral valve is endocarditis. That means inside the heart and the blood is not flowing. And also remember, follow-up appointment with the dentist and let them know that they have rheumatic fever problem, rheumatic heart disease, because prevent them from oral infection. Everyone is okay? And activities question, antibiotic you will give them, prevent them getting more sore throat and infection. Are we okay? So that's rheumatic fever. So everyone must know, anything coming here, if you only read one line, that's not enough. That's why I'm talking is you must go back and look in that. If you haven't done the peds, whenever I'm doing peds, or look in there and you must know. But if you write it down at least and start memorizing, there are 4 areas are affected. How do you get infection? Through sore throat. Where is it in getting infection? To it damaging the heart, damaging the brain, skin, and the joints. And what diagnosis you will do? ASO and ESR. Now we'll move on to the next thing is rheumatic fever, cerebral palsy. Cerebral palsy, the muscle weakness in the babies. Underline the word birth injuries. And also decrease oxygen to the brain tissue. And it leads to the muscle weakness. So cerebral palsy means the muscle weakness. Anything swallowing problem, continue giving them exercise and let them do whatever the child can do. Next is 98. Intracranial pressure should be less than 2. Measure head circumference. That means is in the babies, I want you to write down is hydrocephalus on the side. Hydrocephalus, and everyone should start knowing your normal growth and development. Hydrocephalus, the babies are, and what is with hydrocephalus babies are, is too much of cerebral spinal fluid. And that is produced more or not draining. There is a word in the brain, is also the ventricles. So remember, the word is the ventricle. And so it's also your ventricle in the heart, and there is a place in the ventricle, and so they're either producing or not draining the cerebral spinal fluid. Babies' head circumference is not normal, it's bigger. What do you monitor for hydrocephalus babies are ICP, and you prevent them from seizure. Now we all know ICP, many sign and symptom. Very important here is baby, what is another one of the sign and symptom of ICP? Vomiting. So what would you prevent child here is, we all know vital sign, headache, and remember the word vomiting. And if you have a newborn baby and they have hydrocephalus and you're feeding them, you prevent them from aspiration. Everyone is okay? So keep that in mind. Aspiration question maybe on there. And second thing you remember, because the size of the head is big, prevent pressure. Maybe you're using a crate mattress or sheepskin. Sheepskin is soft padding they put under the baby's head. We used to use a lot on the bed, over the bed, to prevent from bed sores. Now, sheepskin, soft underneath the head, turning on the side, feed them slowly. They will be going for surgery. And what do they do the surgery? So everyone knows, what are you monitoring babies who has is hydrocephalus is ICP. Now in the children, you all know bulging fontanelles, shrill cry. I want you to write down. And very lethargic, sign of ICP. Shrill cry, baby is crying very softly. And also lethargic, baby is lethargic. And that is also sign of ICP. And bulging fontanelles, vomiting for preventing from aspiration. Now what do they do for the babies here? They do the shunt. And what is the shunt is called? Ventriculoperitoneal shunt. Ventriculoperitoneal shunt. So ventricular means from the brain. Ventricles, they're draining the fluid into where? Into the peritoneum. The other one is arterioventricular shunt. Arterioventricular shunt, arterioventricular shunt is draining the fluid in the right side of the atrium, in the heart. And peritoneum is draining in there. So if they didn't give you any question, and they're saying child is coming back from ventriculoperitoneal shunt, that means it's for hydrocephalus baby. What position do you put the child now? You keep the baby flat. That means normal position. Flat position. If you are turning, you can turn them unaffected side. So they're saying shunt is on the right side. Turn them, you can turn them on the left side. Only you will increase or raise the head of the bed when ICP will go up. Are we clear? So what are we monitoring after surgery? Are ICP. If ICP goes high, then what do? Then you change the position to semi-Fowler's. Everyone is okay? Flat is okay? Unaffected side is fine. What are you monitoring? You are monitoring, number 3, is abdominal distension. If this is the one you have, and monitoring again for ICP. All sign of ICP. If ICP is high, then you will go semi-Fowler's position. Everyone is all right. And monitor for infection, but monitor the blockage. What are the drugs are important when you have ICP question? Because you want to prevent them. These babies will stay on seizure medication. Are we clear? Shunt has to be replaced as they grow. They need to monitor the shunt is functioning, and they may need to change the site and the thing, and protect them. When they grow up, you still monitor them for seizure and protect their head for head injury, because when they have seizure, they can get head injury. Everyone is okay? Hydrocephalus, and the shunt is called what? Ventriculoperitoneal shunt. Now I will move on number 9, cerebral palsy, ICP we did 98. 99, dilantin. We all know seizure medication is dilantin. What is the main side effect of dilantin? We all should know, gingival hyperplasia. If they give you a question, child is having seizure and child was taking dilantin for seizure, and during seizure you notice the gums are bleeding. What do? Notify. Why? Because they are telling you patient was on dilantin. That means patient is bleeding, and that's a side effect of dilantin. Now, it may not be a straight answer. What is the side effect of dilantin? Remember, anywhere gum bleeding, side effect, we got to notify. So, dilantin is a seizure medication. Next is meningitis. Meningitis, what isolation do you put on meningitis? Droplet. And what would you monitor the child for meningitis? Is Kerning sign. Kerning sign means the leg. When you flex the leg, they have pain. They're very stiff, pain in the leg. And Brodowski sign is pain in the neck. And that means the body becomes stiff. What is the early sign of meningitis? Or knuckle rigidity. Make sure you guys add there, knuckle rigidity. Early sign is knuckle rigidity. What are you monitoring your patient who has meningitis? Again, ICP. What are you preventing here? Seizure. And what are the other signs are? What are the other signs of meningitis? Photophobia. You've got to put them in a dark room, quiet room. Photophobia. And fever. Fever. Photophobia, fever, Kerning sign, Brodowski sign, knuckle rigidity. And what would be, you are putting them in isolation, we know, and you must start antibiotic. Next is Wilm tumor. Is a tumor in the kidneys. And I want you to write down the word nephroblastoma. Nephroblastoma, same thing. Nephro means kidney, blastoma. Nephroblastoma or Wilm tumor, same. Wilm's tumor. And what do you put a sign or communicate not to palpate? Because it can, and where is the tumor? And the kidney. What do you monitor? Urine output. What do you monitor? Hematuria, maybe. So urine output you monitor. And kidneys, when it's affected, is your blood pressure. And renin. Renin affects your blood pressure from the kidney. Renin would be increasing and your blood pressure would be high. So monitor the babies. Number 1, palpation. How does the mother would feel? It's growing, the clothes are getting tighter. And number 1, do not palpate. Number 2, it's in the kidney. Any question? What are you monitoring? Urine output. What are you monitoring? The blood pressure. And monitor, it can lead to hypertension. Number 102, hemophilia is passing from the mother to the son. So it's a sex-linked disease, hemophilia, and from mother and is passing to the son. What is hemophilia is? Bleeding and clotting disorder. Very good. And factor 8 and factor 9 are missing. Factors are missing. How do you treat them? Give them factor 8, factor 9. And sometimes it's called clotting protein. So remember the word clotting protein. And first answer you give them IV is your factor 8. So remember, anything on hemophilia, bleeding disorder, and you monitor for bleeding, prevent them from bleeding, and it runs to the male child and from the female mother, and so it's called sex-linked disease. Page number 11, we are on page number 11, and on 103. Phenylalanine, very important, we know this one, that goes in the peds. What is phenylalanine means is too much of phenylalanine level is high. And what is phenylalanine level you're checking when the babies are born? So write down there, phenylalanine level blood test is done. What is the name of the test? Is called Guthrie test. So write down the word Guthrie test. And you take the blood from the baby's heel. And when do you do the Guthrie test? After the mother feeds the baby, not as soon as baby is born, maybe in first week, maybe after 3 to 4 days, but not before feeding. Baby must ingest, maybe the word is ingest protein. They must be fed, babies, at least 3 to 4 days, whether breastfeeding, formula feeding, but do not do the test early, must be wait at least 3 to 4 days to know exactly. What is a normal phenylalanine level? 2. More than 2 would be considered abnormal. 8, 9, 10. Less than 2 means baby is okay. So normal is 2 is the reading for phenylalanine test is. And what would happen if the baby has high phenylalanine level? They lead to irreversible mental retardation. What would be happening? Brain damage. So remember, the word is brain can damage, and they can lead to mental retardation. Child will have abnormal behavior, and so that's why it must be treated right away. And that means if baby has positive, and what do you do in a diet question? Restrict protein. What do you restrict here? Protein. And artificial sweetener. Artificial sweetener. All right, so everyone should know phenylalanine question. You got to do the blood test to check phenylalanine level. More than 2 would be considered higher. Below 2 would be considered normal. If it is positive, you do not give the babies protein and artificial sweetener, okay? And protein is all their life, and there are prepared formula without the phenylalanine, and that those are found in the market, pro-free formula, and there are some formulas are available, and the child has to be given. So what are you preventing the child here? Mental retardation. You are preventing all children, all 50 states, all the babies must be screened for PKU. The disease is called phenylketonuria. So PKU, and what are you checking here is phenylalanine level. Everyone should know very important questions on peds. All of them we have done are important, and you have in my peds notes very clearly. You can read more, but a main wording, I'm already writing it down. Next is, you will go 104, Buck's traction. The tractions are immobilizing. Russell tractions are skeletal or for femur or lower leg. What do you monitor in Russell traction? Under the knee area, right down there under the knee. And what does it cut the circulation in Russell traction is popliteal space. Popliteal space is under the knee because they have one sling. It's a skin traction, but there's a extra sling which is supporting the knee. And what will happen to the babies here or the person who had Russell traction, because the sling is putting a pressure under the knee. So what will it cut down here? Circulation. What skin breakdown you're monitoring under the knee and popliteal space? That's a skin traction on Russell tractions are and applied on femur or lower leg. Dunlop traction is used for humerus fracture for the hand. and vertical traction, skeletal or skin traction. Brain traction is used in children under 3 or weight less than 35 pounds with femur fracture. And brain traction, remember, the baby's buttocks should not be touching the bed because the legs are going like this. The little legs are vertically hanged up, and you're preventing them from not touching the buttocks, because if they're touching, the traction will not be applied. Place apparatus first. Place the weight on putting on traction last. So what does it mean? You fix all the traction, whether it's a skin traction, a skeletal traction. Remember, a skin traction, you're monitoring skin care. Skeletal tractions, you're monitoring the drainage and the site for infection, pin site, and you're cleaning those pins. But they're saying, when do you put the weight? So you fix all the traction, however they have to put it on. The last thing, you're going to add the weight. So weight should be added at the last. We do not touch the weight. We do not do anything with the weight. And who will be monitoring the weights here are the physician. They will order how much weight would be needed. So we do not do anything in the weights. Now, so that goes in your traction question. What are the priority for your traction questions are? I want to write down here for you guys are a skin care, skeletal traction for infection, and do not turn them on the side. Remember, let them use the trapeze. Let them pull up themselves and change the linen from bottom to top or top to bottom. But you do not turn your patient with traction. What are the bedpan? Special bedpan, fracture bedpan, you give it to them. And what do you monitor patient is in a traction, a skin care. What do you do for your skin care? Put the lotion, whatever you're doing, go under the skin and let them lift themselves. Do not turn them on a back care questions. Everyone is okay? Do not turn them. They should use trapeze. Let them lift and clean them on the back. And you are not turning. No range of motion of the leg of traction. I said the word yesterday, isometric is a good exercise. So if they ask you, what exercise do you encourage? Your patient has traction, no range of motion. They already have fracture. What exercise you will give them? Isometric or contraction and relaxation of large muscles, abdomen, thigh muscle, but no range of motion. I'm throwing a few more extra wording because anyone taking exam would be helpful because we deal with a patient with traction. What do you monitor and prevent your patient with traction? I want you to make sure when your patient has traction, the risk of skin problem, number 1, and if you have skeletal, monitor for infection. Number 2 is UTI. And number 3 is constipation. Keep that in mind. Because they're laying in a bed and they can't empty the bladder and they can lead to what is UTI. So make sure we all know some of your questions, how to handle your patient with the tractions. Your questions are going to be how CNA is turning, how you're giving. Make sure we know these are the questions can be on your traction patients are. Now, number 109, placenta. Where does the placenta should be normally? In upper uterine segment. Very important. And which, that is normal. If placenta is in the lower uterine segment, that is abnormal. Which mother has in lower uterine segment? In placenta previa. So make sure we know placenta previa is not normal. Abruptio placenta is normal because the placenta is in the upper uterine segment. But because mother has hypertension or preeclampsia, she starts bleeding. But where should be the placenta? In upper uterine segment. 111, vertical C-section. Patient with vertical C-section surgery will be more likely to have another C-section. Mother has C-section vertical, next chances maybe mother would have another is C-section. Page number 11 on a Spiderman package. Next is 112, amniocentesis question, 20 weeks, you can do it. And check for cardiac and pulmonary. Why do we do is amniocentesis? Now you can do genetic problem, you can check other thing, but what is it important here is we are monitoring for what? Cardiac and pulmonary abnormalities. What are we monitoring here? Pulmonary abnormalities. Next is, I want you to write down on the side, if you do before 20 weeks, what do you tell the mother? Full bladder, not to empty the bladder. After 20 weeks is empty the bladder. For 20 weeks, full bladder, and before 20 weeks is full bladder. After 20 weeks, empty the bladder. Because they're going to ask you, what would you instruct and why you're doing this amniocentesis. Amniocentesis, you can do sex and you can check genetic problem, but very important that we must know congenital pulmonary problem and cardiac problem. Now, next is, what do you monitor after amniocentesis? I want you to write down on the side, fetal heart rate, fetal distress, fetal heart rate, and number 2, mother can go in early labor, membrane rupture early, bleeding and infection. 3 things, bleeding, infection, and mother can go in early labor. Everyone is okay? If you know that much, would be good. Amniocentesis is one of the tests would be done, and you're monitoring the mother for bleeding, monitoring the baby for distress, and mother can go in early labor. 113, Rh negative mother and positive baby, we give them ROGAM. And also to prevent Rh incompatibility. Next is anterior fontanelles. We all should know, closes late, 18 months. On the side you can write down, you do have posterior fontanelle closes around 6 to 8 weeks. Everyone should know. Your question on growth and development, and they will throw. Posterior fontanelles are not closed. Baby is 2 years old. That's not normal. You got to notify. So we must know posterior fontanelles and anterior fontanelles are when they are closing. So that's good. Number 115, caput succedaneum. What is caput succedaneum? 115, underline the word edema. There is a fluid where? On the fetal scalp. And very important, it crosses the suture line. The meaning is we have the suture line and it's going from one side to the other side. Are we clear? So it's closing and it's going on the others, crossing the suture line. So when we are talking about caput succedaneum, is the swelling, and there's a edema. And how do you differentiate? That means it's crossing what is the suture line. It's normal, it will reabsorb and it will disappear in 1 to 3 days. Next is number 16, pathological jaundice. Comes before 24 hours. That's not normal, you need to notify. Then you have is physiological jaundice comes after 24 hours. Number 117, you have placenta previa, goes in OB question. What do you monitor for placenta previa? What is placenta previa is there is no pain and there is bleeding, and placenta abruptia, there is a pain but no bleeding. They may have some bleeding but not a whole lot of bleeding. I want you to add there in placenta previa. What is placenta previa is, placenta is in lower uterine segment. And no vaginal exam. And also I want you to add in placenta previa, abdomen is hard. When you are touching, abdomen is soft. In placenta previa, abdomen is soft. There is no pain. Placenta abruptio, placenta is where? In upper uterine segment. That's normal. What is the mother is having? Pain. And abdomen is hard. So everyone should know placenta previa and abruptio placenta, page number 11. And now so everyone is okay, which one is abnormal placenta is? Placenta previa. Where is the placenta is in the lower uterine segment. Abruptio placenta is normal. What is the reason mothers start bleeding here? What is the problem with the mother here is starting the bleeding? I want you to write down on the side, abruptio placenta, mother is having hypertension or preeclampsia. Which mothers do you monitor? Hypertension, preeclampsia can lead to bleeding and is abruptio placenta. If you need the package is right here. And I'm on page number 11. And so next is placenta previa. After that, 118, betamethasone. Betamethasone is the medication. It's called Celestone. And what is betamethasone are? Is surfactant. Why do we give them? Is to open the lungs. What is it called? Surfactant. And for lung expansion, when do we give them? Write down on the side, 28 to 32 weeks. 28 to 32 weeks, you give them, and to prevent for lung is maturity, you are giving them for lung expansion. And what do you monitor when you are giving betamethasone? Because it says steroids. Monitor for blood sugar for the mother. You are giving it to the mother. And infection. Why? Because risk of infection, it says steroids. Are we clear? So what is betamethasone is a steroids. You are giving 28 to 32 weeks to improve the surfactant of the lungs. Next is 119, dystocia word. Dystocia is difficulty in having a labor. Baby is not moving down. That means the mother is not progressing in the labor. Mother comes in, but the labor is not starting. And that means dystocia, difficult labor. Baby is not moving down. Now, if they give you that word, mother is having dystocia, what do we do as a nurse? So that means baby is not moving. What do you do? So on the side, maybe you can add, first thing, check the fetal distress. Are we clear? Fetal heart rate. Number 2, check if the membranes have been ruptured or not. Third thing, you check the contractions. The mother is having contraction. Fourth thing, you check the pelvic size. Is normal or not? Because sometimes the pelvic is smaller and is not moving the baby. So you have to write it down on dystocia word. Maybe you may have to artificial rupture the membrane. Maybe they have to use the forceps to bring the baby out. Anything is in the answer. You are assisting mother to go. But before you do anything, you got to do assessment if mother is okay and baby is all right. So that goes toward dystocia. 120, Pitocin. Why do we give Pitocin? To increase uterine contraction. Pitocin is given for contraction. Number 121, magnesium sulfate. Why do we give magnesium sulfate here? Is to prevent seizure. Which mother do we give magnesium sulfate? Preeclampsia. And what do you monitor for mother? Underline deep tendon reflexes. If the mother are absent or ineffective word of deep tendon reflexes, you cannot give magnesium sulfate. And I want you to write down on the side, antidote is calcium gluconate. You give calcium gluconate as antidote. So magnesium sulfate is very important you are monitoring, okay? Now, next is magnesium sulfate antidote, calcium gluconate. Now, next is 122 is basically how you read your question. Do not use why I understand when dealing with the patient. Is number 123 is important. Milieu therapy is a mental health question. What is a milieu therapy? When patient is mentally sick and they have schizophrenia, bipolar patients, where do we admit them? In the hospital. And what is milieu therapy? Is safe environment. Write down the word safe environment. It says patient environment there, and write down the word safe environment in the hospital, and where the monitor physically and socially. They're not by alone. They're doctors, the nurses, social worker, everyone involved in patient's care. But the wording is called milieu therapy. What is the meaning milieu therapy? Safe environment for patient treatment physically and socially. Are we clear? So add the word is good and safe environment. 124, cognitive means thinking process. Cognitive means is counseling. Patient who cannot make decision. Cognitive word can be poor thinking process, can be for Alzheimer patient, and you cannot think, you cannot function, and what do you do with them are help them to live in a safe environment by counseling. So cognitive means thinking process, and that word can go for mental health question, can go Alzheimer patient. How do you treat somebody's cognitive process is not there? By counseling, by teaching them how to live normal. That goes again in your mental health question. Crisis. Crisis means something all of a sudden your patient get very sick and acting up, or crisis is always short time. Crisis is an emergency. Something happened, changes. Crisis are short term. You do the treatment, the crisis is over. 126, how do you deal your psych patient in your question? Number one, any question you have, mental health, bipolar, schizophrenia, number one, safe environment. Patient need to be safe, and you need to protect other patient. Now, where do you put if you have a patient who has schizophrenia and who is feeling this world is not good, and patient is very bad in schizophrenia and bipolar? Separate room. Are we clear? And separate room, safety, don't put them in a group activity, because safety is important for other patient as well as for that patient. And they feel everything is threatening world. So safety is you protect that patient as well as you're protecting the others. Number two is very important for all your patient, but mental health patient, when they're asking you, set limiting. Now, we are using in mental health set limiting, but in other patients, if you are admitting in nursing home, you are admitting in a hospital, what do you give them? Is patient's right and rules and regulation. Policy. When do you tell them what is your policy of hospital? What can they do, what they can do on admission? So when you are admitting or seeing your patient in mental health, you must set the limit, whether they are bipolar or whether they are alcoholic patients are, but you must let them know what they can do, what they cannot do. Everyone is okay? Because if you don't tell them, they're going to do whatever comes in there. You got to still set the limit. Next is very important. What are they missing in life here? Trust. And what do you develop? Whether it's a mental health or whether you are dealing with your regular patient, is it important to establish the trust? How do you establish the trust? Don't promise something you're not going to do. You tell your patient, I'll be back in an hour, make sure you go back. You tell the patient, I'll get you this information. Don't forget that. Because what happened, you promise them and you don't do it. Does your patient will trust on you? No. Trusting is important on all your answer. medication. You're dealing mental health patient, make sure they take the pills. There are patients who will tell you, oh, I'm very good, I'll take it, just leave my pills here. I don't feel like taking now, I'm eating my breakfast, but leave my pills here. No. I have seen patients and they're hiding their pills and they will pretend they're taking the pills. So it's our responsibility to make sure they swallow, make sure you see they have taken their medication. Leaving at the bedside is not acceptable. Any patient, whether it's a mental health or med-surg, we must see your patient has taken medication. Very important is your next line. Any question before restraint, physical and chemical restraint. What do we do for our patient? Less restrictive method. What is the meaning, less restrictive method? Something simple measure. Don't pick up the restraint. Your patient is agitated, your answer, a patient is climbing out of the bed. What do? Pick up a restraint, tie the patient? No. What do you do before? And this is a law. When anybody you apply the restraint, and that's a policy, you must show in your care plan, what did you do? Maybe a patient who was climbing over the bed, you got a lower bed. Are we clear? And maybe you're putting close to the nurse's station. Maybe you have 1-in-1 to monitor that patient. The meaning is, when you pick up a restraint, that's a physically, what are you restraining? Patient's movement. When you're giving chemical Haldol, you are restraining by chemically you are injecting and restricting their movement. You cannot restrict movement unless you have tried some less restrictive method. Are we clear? Any questions for restraints? Haldol, chemical restraints, patient is climbing over bed. Look at the answer. Don't pick up, tie the patient, give Haldol. Look at, maybe have someone sit with the patient. Maybe lower bed. Maybe you are answering call light. Maybe patient is climbing because of the going to the bathroom. Take them to the bathroom frequently. Maybe that's your answer. So keep in mind, very important, we all are screening our patient and we are not putting a restraint. We are going in a restraint-free environment. Nursing home everywhere. Our regulations are have your facility restraint-free. And anybody you're trying to restrain, you must have the time limit, how long, and reassess your patient before you tie them. So remember, those are answers are. Now 126, next is SSRI, are your selective serotonin, your antidepressant medication are. And what are some of those medication are? Prozac. I will write down here is some of the medication. Prozac, that's a depression medication. Prozac, you have Paxil, Celexa, and those are your SSRI. And mostly SSRI should be given in the morning, AM time. And so monitor when you're giving depression medication, takes a longer time to work. SSRI is your antidepressant medication. Some of the name I wrote it down, and the best is these are given in the morning. Prozac, Paxil, and Celexa. You got to recognize some of the medication because in your exam, they're going to ask you the drugs. And we do pass all the medications, so we must know. Next is 127. Obsession is a thought. Compulsion is action. So what is it here? The word OCD. Write down the word obsessive compulsive disorder. And I will say few words here. So any question you come, at least you will have idea how to handle your patient. So what is obsession? Obsession is your thought. In the mind, patient is getting, my hands are dirty. What is compulsion? Is action. And what is action is washing hands. So that is it, and D means disorder. So what is patient is doing? Compulsion, because in their mind, what are they feeling? My hands are dirty. And what they're doing? They're washing their hands hours and hours. And that may be for one patient. Obsession is a thought. Compulsion is a action. And second thing I want you to remember, these are not psychotic disorder. What kind of disorders they are is called neurosis. And what is neurosis word are? Whenever you see the word neurosis, nervousness, anxiety. And what do you do if you will tell them to stop washing your hand? You are causing more anxiety and you are causing more nervousness. So what do you do for your patient who has OCD? Number one answer. What is hand washing is called rituals. They're doing their rituals continuously. So number one answer, let them do their ritual. Don't stop right away. Number two answer, you want to write it down, is keep them busy in other activity. That would be good. You are taking them and planning other activities so they can go in another activities and participate in activities. And number three, plan their schedule. A schedule, written schedule would be good. How long they should stay in the room, how long they should wash their hand, what time they should come in the dining room, what time they should go. So what is it? Written schedule. Number four, the next is safety. It's important. They're busy in one thing and they're washing hand. Maybe the skin is peeling. Maybe the skin breakdown on their hand. Maybe they're losing weight. Why? Because they're not getting out, they're not eating their food. So pick up these kind of answer. So everyone, OCD goes in mental health and OCD is neurosis. And how do you teach your patient? How do you do? Never pick up answer to tell your patient is stop washing hand and let's go to the dining room. First thing is let them do it. Then you talk to them, plan with them, and keep them busy in their other activities. Safety is important for your patient. Now what can happen? Two patients are in the room. One patient is in the bathroom, other patient is getting angry. They can go and hit her or hit that patient. You got to protect both patients. Both patient has a right. Patient who got hit, a patient who hit, you got to separate them. Are we clear? Safety is number one. Any question? Two patients hit each other, you got to fill out the incident separately for both patients. You got to do the care plan for both patients. Why? Because you have to have plan. This patient is not able to control anger, patient hit it, this patient behavior is bad, and you got to do the care plan. Everyone is okay on OCD question. I will move on to the next is 128. Hallucination and delusion. In the mental health, hallucination means our sensory perception. Write down the word sensory perception. And what is the meaning? Sensory perception is their sensory, their feeling perception. Sensory perception. Feeling is, what are the sensory are? Hearing, smelling, touching, and that is your senses. Patient is hearing, somebody is talking to kill him in the next room. No one is in the next room. But what is patient is? Hearing. Are we clear? So when they hear something, it goes in your schizophrenic patient. They hear people are talking about them. And that's a sensory perception. Now, that's not good. Patients smell. There is a gas leak and there may be a fire and someone is planning to kill me by burning. That's the sensory perception. That means it's not real. What is delusion word is? Delusion word is fixed idea. What do they have here? Fixed. You cannot change their mind. Fixed thinking about something. And that means that both are abnormal. They're not normal. So who has hallucination and delusion? Psychotic patient. So write down the word psychotic. In your question, when you see psychotic problem, that means is bad. That means patient has hallucination. When they're saying neurosis word, nervousness, anxiety. And you can talk to them, you can bring them normal. But which patient you will not argue are your psychotic patients. And who are in psychotic patients are your schizophrenia and bipolar patients are. And so what do you do when they have hallucination and delusion? You don't agree with them, but be nice and say, I don't hear these voices, you may be hearing. Are we clear? So you are still saying you may be hearing, and that's okay, and you can get help and you can get the treatment, but I'm not hearing. So what would you be? Reality. You are talking the truth. You are not agreeing with them, and do not touch them. Everyone is okay in your question. And do not promise them. Safety is important for these patients, and you give them their medication. They really need to be having their treatment. So that goes in your psychotic, schizophrenic patients are, and bipolar patients are. So that goes in your hallucination and delusion. 129 is in thorazine. Thorazine is antipsychotic medication. And yesterday, also we talked about the side effect of antipsychotic medication. One of them was EPS. And what is EPS? Extra pyramidal symptom. What was the other one? Neuroleptic disorder. I like to repeat it because these questions are very high and we all should know by memory. And so what are the side effects on your patients are? Number one is EPS. And I said yesterday, tardive dyskinesia. Tardive dyskinesia. And what are these are? Involuntary movement. In your question, maybe stiffness is another answer. They become very stiff. And number three is neuroleptic disorder. Neuroleptic disorder means they have fever and their blood pressure is fluctuating, going up, and they're drooling. And what do you do here in neuroleptic? You stop medication in your answer. What do you do for EPS? We said give them medication. What medication do we give them? For EPS, I said the other day and yesterday, cogentin. Cogentin. You can give them Benadryl. And you can give them Artane. And these two medications are also for your Parkinson patient drugs are. Now they can throw this drug, cogentin, and they can say, where do you give them? Or you have a patient with Parkinson. Yes, it is a Parkinson medication. And what happened to the Parkinson patient? They are shaking too. And patient who start, and some question, you're giving thorazine, and doctor added cogentin. Why does the doctor is giving cogentin? Your answer would be to prevent EPS. Are we clear? Because it is a side effect. And if your patients are staying longer, they start shaking, they start drooling, and that is a bad side effect. So now what we do it, we start two medication together so patient will not have these side effects. So everyone make sure we know this side effect of your medication, EPS word, tardive dyskinesia, and neuroleptic disorders. We talked in different pages, so make sure you guys know that. Next is, you will go on 130, Alzheimer patient. What is Alzheimer patients are is a degenerative problem in their brain. There's a changes, chronic, progressive, degenerative, and remember the word cognitive, thinking process. And we use the word dementias in the last word. Dementia means they forget and they are not normal and they cannot make decision. Alzheimer patients are. What is the main problem with Alzheimer patients are? They are wanderer. Write down that word, wanderer. They're very unsafe, but don't lock them up. Don't put the restraint. Let them walk around. That's their problem. And we have to provide a safe environment. And orientation, keeping family members' picture in the room. Let the patient hold it. Patient wants to carry her own purse. Let her hold it. Why? Because that's a security for your patient. Maybe a blanket she recognized. Let them use it. So Alzheimer, wandering problem, number one. They walk around all day long and they don't eat. So you can give them finger food. And safety is environment. Family members' pictures are good. Clock is good. Orientation. Pictures are good. And that is why you can guide them where to go. So that is Alzheimer. I want you to write down the medication for Alzheimer is important. We all know is Aricept. Aricept is improving memory. And another one is Namenda, N-A-M-E-N-D-A, Namenda and Aricept. These two drugs are very important. Aricept is given more at bedtime, at chest, before bedtime. And what do you monitor when you're giving Aricept? See if their cognitive thinking process is getting better. So it's more like a memory medication. So what are we improving here? Their memory. So I'm giving you some of the words are common medication, and you never know what can pop up in the exam. And Aricept is given at the bedtime. Namenda, other medication are. Wandering is important. We all know safety. Orientation is very important for Alzheimer patients are. Underneath, you have insulin. In the last line, in insulin, the fourth line, that's important. And we all know when you're putting air, you put in NPH. That's a cloudy insulin. Then you go into regular. But when you're drawing, then you draw first regular, and then you draw NPH. When you open your insulin, make sure you put the date. You can leave them at the room temperature. How long your insulins are good for 30 days. Next is number 2, hyperthyroid patients are. What is hyperthyroid are? It's called Graves' disease. And what is high in hyperthyroid patient are is BMR, basal metabolic rate. And what are they having a problem? Underlying nervousness, very important. They gave you like Michael Jackson, but very important they is nervous. Their eyes are bulging and heart is beating, palpitation, nervousness. And what else we remember for hyperthyroid patient are mood swing. Mood swing. And remember, where do we put patient with hyperthyroid are? In a separate room because they're nervous, mood swing, and separate room would be best for them to keep them away from other people. And so that's important, we all know on that. Now, atropine underneath, so everyone should know hyperthyroid Graves' disease, they're going for surgery. What are the medication we talked about? Hyperthyroid medication are PTU and tapazole. Everyone should know those drugs, PTU and tapazole. And if patient is going for thyroidectomy, what is the complication I said is thyroid storm. And thyroid storm, you can give the same medication. That's why I want you, if they give you in your question, patient has thyroid storm after, which is the complication are after thyroidectomy, and they ask you what drug. You got to give them drug right away, IV, and you give them is tapazole and PTU. Everyone should know their medication, and you're giving after thyroidectomy. What is the main complication after thyroidectomy? We already discussed about that, is what does the patient is losing here? Calcium. And what does calcium affect here? Is laryngeal stridor and tetany. Everyone should know tetany and laryngeal stridor. Now, next is some of the drugs you have underneath here, and atropine is used before surgery. Anytime atropine, decreasing secretion, preventing aspiration. Phenergan is for vomiting and nausea, which is called antiemetic. Antiemetic is for nausea and vomiting. Diazepam, the word is Valium. And why do we give? It's a tranquilizer. It reduces anxiety, and also you give when patient is having seizure, and then why you're giving to relax them and relaxing their muscle. Demerol is for pain. Who you do not give Demerol for sickle cell babies. Are we clear? So you have, do not give Demerol for sickle cell baby. Now remember, sickle cell babies are having a lot of pain. You do need to give medication, and what medication you will not give it to them here is Demerol. And who you will give Demerol and not morphine when you have gallbladder problem and pancreatitis. Are we clear? So you remember that way your question. Now, I want to go over a few lines here before we take a break, is sickle cell anemia. I want you to brush a few lines here, so you must know in a right way. A sickle cell is clumping of blood and lead to anemia and obstructing the blood vessel. So, what happened in crisis question? Patient or child has sickle cell crisis. Now, what do you monitor? Number one, pain. What is the pain they have is in the joints and pain in abdomen. So, abdomen pain and the joint pain. And they have fever. So, if they say, what do you monitor? Child has sickle cell crisis. Number one, fever, and number two, they have a lot of pain. Where? In the joints and the abdomen. Why do they have pain in the abdomen? Because of enlargement of spleen. Write down the word spleen. And if they give you the word squasterum, word is for, or squastural crisis, that means you're monitoring for spleen. Squasterum or squastural crisis is only in sickle cell babies. And that means enlargement of the spleen. And also in sickle cell babies, the bone marrow are affected. And what kind of anemia would be? Aplastic anemia. And what is aplastic anemia? What isolation do we put them? Aplastic anemia, reverse isolation. Why? Because of white blood count. What is in the bone marrow? We have red blood cell, white blood cell, and the platelet. So aplastic anemia is the only anemia you're protecting the child and the patient from reverse. And what isolation you put them? Reverse isolation. Everyone remember two things. Aplastic anemia, they have pain in the abdomen. Remember the word spleen. Remember the word is affecting bone marrow, and your answer may be one. What do you prevent babies who have sickle cell anemia? Prevent them from infection. So I will say infection. Don't forget in your question on that. Now on your treatment here is H. Is hydration. Write down the word, you give hydration. Heat. Heat means you're giving, applying to the joint. O, oxygen is important. P, pain medication, but write down the word no Demerol. So remember, these are keywording. Then you go on positioning, because they have a lot of pain in their legs. Do not raise their knee. Do not make their head of the bed very high. Because when you put them high, it causes them a lot of pain. And knee gauge. What is a knee gauge? When you raise and you're raising the foot of the bed and you're bending the knee. So no knee gauge, no pressure on the knee, because they have a lot of pain. So few lines, but it helps you answer right question and right answer. What are you preventing here? Infection. What are you giving them here? Hydration. Whether you increase fluid, IV, or you increase oral fluid. Both answer would be correct. Give them oxygen, give them pain medication, but no Demerol. And the last word here is iron medication, Z-track injection. You're going deep, and Z-track injection is IM injection. and while you're preventing the staining of the tissues and the skin. Now, underneath is not that important, so I will not do it. We'll take a break, and we will start page 13 as soon as we come back on the breaks, on page number 13.